Hi friends, it's Jess with our Bipolar. Welcome back to my channel. If you're new here, just a little bit about me. I have bipolar 1 and I was diagnosed 26 years ago when I was a sophomore in college. Today, I'm back with an update. I talked to my psychiatrist about the lithium use and causing kidney dysfunction and what we should do. So should we lower the lithium and add the Lamictal or not? But before we get right into that, I'll ask you to please subscribe to my channel, like this video, comment, all the things. I would love to hear your thoughts on this topic. My video talking about my kidney dysfunction because of lithium use just went live today on YouTube, but I had an appointment this morning with my psychiatrist. So I just wanted to kind of get this out, get out the information to you about what he said we should do moving forward, like what is going to be the plan of attack. Now, just as a brief summary from the last video, go back and watch it, but I'll let you know that I have been on lithium for 18 years and it is the only mood stabilizer I have done well with for my bipolar 1. Before that, I was having lots of rapid cycling, so going into mania and depression very often, like every single month, and that was on other mood stabilizers. So I've tried everything except for Lamictal. That's where we are now, and my kidney dysfunction is still relatively minor and holding steady. I talked about my eGFR level being around 53, 52, and my creatinine is at about 1.28. And that has jumped up over a couple years. So yeah, we have to decide what we're going to do, but we have to be logical about it and thoughtful about it. Now, my psychiatrist, who I really do trust, and I trust that he knows what to do, but he was also telling me that there aren't any, what's the right word? See, sometimes with lithium, there are other side effects like word recall, which I just completely lost the word I was thinking of. I think I thought of a way to say it. So my psychiatrist was saying that with lithium and kidney dysfunction, kidney disease is really what it is, there aren't any best practices. Your creatinine levels don't get to a certain point and then they say you need to either reduce the lithium or go off the lithium. And the same with the eGFR. And I'll put down in the description box what eGFR is. Instead of trying to go into a whole description of it, it's also in that first video about kidney dysfunction. So he's basically saying that different nephrologists have different ideas of when lithium should be reduced or gone off completely. Some say it's a creatinine level of 1.4, some say 1.5, some say no one should be taking lithium basically because it can cause kidney dysfunction. We don't have just like rules to follow here. You know, I'm not a doctor, and so I'm going to try to explain this as best I can in the way my psychiatrist explained to me. But please talk to your psychiatrist, talk to your nephrologist, do your own research. Once they start having kidney disease from lithium, it could get to a certain level, and then if you went off the lithium, it could get better. Or it could stay at that same level and just stay steady, even if you go off the lithium. So like I said, my creatinine level is about almost 1.3. It could just stay at 1.3, even if I go off the lithium. Or you could go off the lithium and those levels could continue to decline. You're not taking the lithium, you're not taking the thing that is causing the problem, and yet the problem continues. There's a lot going on there. We don't know, even if I stop taking the lithium right this second, that my levels of the kidney dysfunction will get better. So as I said in the last video, I proposed not waiting, going to a lower dose of lithium. Right now I take 600 milligrams, which is not a high dose, but I proposed going down on that and adding the Lamictal now. And we talked a lot about this, and I really appreciated how much time my psychiatrist took with me explaining all of this. But basically what we came to is that this is exactly what we will probably do in the future. But right now, with my creatinine level the way it is and my eGFR holding steady, that we should hold off. Now, one thing I brought up that I thought could complicate things a bit is that if I am going to, at any point, have a med change, it needs to be at the right time, like in my life. So I was saying probably summertime would be the best time to do a med change. And if we don't do it this summer, we would have to probably wait until next summer. And what if my kidney levels continue to decline? So should we just do it preemptively? And what we decided, just as of now, is no, we should not do it preemptively. You know, I have a lot going on in my life. I work full time. I have a family. You know, I do this work on YouTube. I do advocacy work. And just for me, it does make sense since my levels are pretty much holding steady and are not too even like the 1.4 for the creatinine level, which seems to be a threshold for some nephrologists, and that's like a high threshold. Some say to wait even longer until it decreases to 1.5. So we're gonna keep monitoring, and for now, I will just stay on my lithium of 600 milligrams and taking the tiny bit of Seroquel as well. And he did also talk about, well, you know, we could someday, we could decrease the lithium and just increase the Seroquel. And of course, I was not all that comfortable with that. If you've seen some of my other videos, you might have seen the Seroquel weight gain videos. Seroquel is not a drug I enjoy in higher doses. I take what I have to take, mostly to have good sleep and to also use as a rescue med for hypomania. But other than that, I'm not thrilled with increasing the Seroquel. And in case you're interested, he did explain how it would go with adding the Lamictal. So what I would do is I would stay on the lithium dose I'm on, and then we would slowly titrate up on the Lamictal, because I guess one of the big concerns for Lamictal and some other drugs is a rash you can develop, and you could develop Stevens-Johnson syndrome, which can be fatal. And I know someone who actually almost died from that. But usually people can tolerate Lamictal, and one of the ways you can prevent it from happening sometimes is by not going on a high dose of Lamictal right away. You titrate up. So I would titrate up, make sure I'm doing okay, no rash with Lamictal, and then slowly go down on the lithium, but still be on it. Still have some of that, which I'm wondering, like, maybe I could tolerate a lower dose of lithium just on its own, but let's not get ahead of ourselves. Oh, and just so you know, as far as that rash goes for Lamictal, he said about 5 patients out of 1,000 get the rash. Not even necessarily a severe rash, but just get it at all. So I think that's it. So that's the plan. We're gonna just wait and see, but it's not a comfortable place to be in. And if you're in this place, you're experiencing any kind of kidney dysfunction on lithium or another drug, yeah, talk to me about it, because I really don't know anyone else who is going through this. I just don't even know all that many people on lithium, and especially no one has been on it as long as me. So yeah, I would love to hear from you. All right, well, thank you for watching this video, and I'll see you in the next one. Bye.